Good afternoon, everybody. Hope you all are well. If you can hear me, can you just put a thumbs up, please? Okay, thank you, thank you. Cool. I'm so sorry for the problems on the MS Teams, but I would like to start immediately. Do not take up too much of time. So, once again, welcome everybody. So myself and we have another fifth year who's going to join us, Vukuzi. I'm not sure if Mamilo is going to join. Um, but basically, this presentation is just to basically give you some tips for the year, some advice, some challenges maybe that we experienced in each of the block and how we overcame it, and basically that you can use to build resilience along this this year. So without any further ado, let's go for it. Yeah. So well done, everybody. You basically halfway there. Okay. So basically, you are done with your preclinical years already, and semester six was basically an introduction to the clinical platform, to the clinical years, basically. I just wanna check if there's not any other people in the lobby. Okay. So yeah, so basically, let me just admit people. Okay. So basically, semester six was an introduction to the clinical years, and fourth year is the start of the two clinical years. Okay, and it's very exciting. It's very more practical. But obviously, there's still theory along the way. Okay. But obviously, with anything, we always start on a positive note. Okay. So, okay. So, if you maybe on your phones or PCs, if you go to minty.com and put in the code 3651123, the question is basically how are you feeling going into fourth year? So basically, what emotions do you feel at the moment starting fourth year and start of clinical years? Let me just check. Okay, I'll just give you some time to go to minty.com. Okay, so yeah. I believe the code doesn't work. I don't know if you guys also, because I'm checking here, and okay, let me just check. Um, Code probably expired. Yeah, I think the code probably expired. Let me just double check quickly. There's so many tabs. People. Okay, sorry guys. So there's a new code. So this code is 14529 213. Let me just yeah. Um, okay, so we have excited, scared, anxious, nervous. Yeah. So yeah, so that's basically the emotions got moved, if you like that, especially because it's New Year, clinical years. Uncertain, okay, there's neutral. Okay, we have excited. So we have a lot of people feeling really excited. That's good, that's good. Yeah, so I think I'm gonna stop over here. So that's just a small icebreaker. Now just going back to presentation. Okay. Okay, perfect. So without any further ado, I'm just going to start immediately. So general medicine. So general medicine is one of the blocks. It's quite an intense block. It starts with an orientation week, also called a boot camp. Okay. So you will see that there are seminars that you obviously have to watch. It's basically lectures online and try your best to be up to date because in Gen Med sometimes or at many times you're going to feel quite tired when you come from hospital. So but just try your best to allocate maybe an hour or two to do seminars every day. And with the seminars, there's MCQs as well after most of the seminars throughout the block. And it's for DP, it's not for marks, but you must do. And what's nice about the MCQs is that if you do the first attempt, you actually get the answers, and then you can do the second attempt as well. Um, so you do 5 calls at an emergency center. So basically, you have to picture yourself as an intern, okay? You do work alongside the intern, so they are there to assist you. But you have to like put on your doctor hat, basically. And you have to clock your patients. So clock your patients basically means that, for example, if you see a patient at an emergency center, right? You were allocated a certain patient, and clock your patient is basically getting the history, why the patient is there, and basically coming up with a differential diagnosis and also a management plan. And that you must write in your clock notes. So they will give you a book, like a book that you can write in it with your yellow pages. So always try to, when you always do your clock notes in there so that you have a copy that you can put inside the folder of the patient and a copy that you can keep for your portfolio. So try to see one to three patients on each call. I personally did 1 or 2 patients, but mostly one patient um, on my first day, on my first call, I only did one patient. I spent like I think I spent like 8 hours on that one patient. But it was mostly trying to figure out what was wrong with the patient and basically, yeah, to prepare for that mini clinical exam as well. So you present your registrar and make sure that they sign your mini CX rubrics. Now, you will get basically a book with you can even you have to mark yourself first, and then the 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 doctor that you will basically present your patient to will give you a mark. Okay. The patients you see you can use for your portfolio. So yeah, so the patient that you see while you're on call, you can use those patients for your portfolios as well. And I would advise that you start on your 5 block summary the same night you see your patient. Okay. So, and what helps your clock notes is going to help you with your 5 block summary as well. Right. So, your 5 block summary. So I think that's your history, your investigations, clinical exam, differential diagnosis, um, and then in the middle, it's the actual diagnosis of the patient. Okay. Um, it will save a lot of time if you start with a 5 block summary the same night you see your patient. Then, like as the time go on, so what's gonna happen after your call, you're still gonna go to hospital to see patients, and you're gonna see your patient as well. So you're gonna follow up basically on your patient, okay? And you will always modify a 5 block summary at the end of the block, okay? So there's always time to like modify 5 block summary and ask questions if you are uncertain. After each call, you go into hospital and work alongside class. I said that. So yeah, you draw bloods like while you on duty in the hospital. You like draw bloods, put up IV lines. You do urine catheterization, blood cultures. Like you even learn how to do the ECG, fill in lab forms, and many more. So you should actually enjoy it. Enjoy the practical part of it. And please don't forget to fill in your blue book for every procedure. Now, I really sometimes forgot to fill in my blue book because it gets so busy. But just keep that in mind that always it's basically your logbook. And the HBCSA, the Health Professional Council of South Africa, they come to UCT and they do the authorization and things like that. They actually look at the logbooks of the students. And then, yeah, so that's really important to get your logbook signed for every procedure that you do. And your internal registrar must sign it off. So for tutorials throughout the block, there are tutorials. I would advise to try to volunteer to present your patient and get and basically take it as a learning curve. So you're going to present to the professor or the registrar doing the tutorial. And if you present your patient, you might make mistakes and they might critique you and they might put you on the spot. Um, but just remember it's at the end of the day, it's take it as a learning curve, okay? And obviously you must make mistakes, part of the process, okay? And then you also do Afrikaans and Xhosa in this block as well. Clinical languages, but they guide you very, very well. They set out like what you need to basically say along the bedside. And there are tutorials for Xhosa and Afrikaans as well. And everyone must do Afrikaans and Xhosa. However, it's not graded. You must just pass it. So on your transcript, it's PA. It's pass. You either pass it or you fail it. Um, right though. Msuri and Fukuzi, do you guys have anything to add, please? Can unmute yourself. Yeah.
Hi. Cousin Africans are actually graded. They're just not in the transcript, but they do form part of like your gen med mark actually. So yeah, you have to make sure that you pass them both, but they get relatively easier and you're doing them for the last time, so that makes it easy.
Thanks, Fukuzi. Sorry, yes, I forgot. Yeah, I forgot. Yeah, that's actually, you do actually get marks for that exam. Yes. What about that? Okay. EOB, end of block examination. So the oh, sure. Clinical exam. So for the clinical exam, to prepare this exam, try to like practice on patients in the ward by taking a history and doing a physical examination and trying to come up with differential diagnosis. So if you get time, if you have free time, which they seldom is, but in an event that you do get like time, take like 10 minutes or 15 minutes to get any patient, okay, not any patient, but obviously if you see that patient is willing to help you to say, afternoon, ma'am, would you like, I'm practicing for an exam. Is it possible if I can maybe take a history of you to try, just ask you a few questions? Or is it possible if I can please wait for an examination as part of my preparation for an exam? And if they agree and you feel that, and you can see that there's a good vibe, then go for it. Okay. But if you see the patient is very, very sick and can see, okay, no, this is a critically ill patient, then I would advise don't try to practice on such a patient. Or if a patient is grumpy or anything like that, yeah, I wouldn't advise to practice on such a patient. So in the actual exam, there will be a patient, and you either have to do a thorough history or a physical exam and come up with a differential diagnosis and a management plan. And usually, if you have the management plan, is usually like the bonus marks that you get as well. Um, the clinical skills notes from semester 3 to 5 will help you a lot. I found Talent Corner very, very useful and also keep mechanisms of clinical science at hand. There's an Oxford handbook as well. It's quite handy. And try to make tables for yourself as well, like for the different conditions. So in your table, maybe have what on history uh, tells you that this person has left heart failure or right heart failure or meningitis or COPD or asthma. So history, general exam, cardio exam, respiratory exam, abdo exam. So have a table and columns and just you use that table. It will be very helpful to prepare for the clinical exam. Of course, did you have anything to add? Perhaps that I missed.
The clinical exam. Right. Okay. I mean, for the clinical exam, you just need to like practice a lot. And the other thing is that you have to think on the spot. So the advice I'd give to you is just practice diagnosing patients while you're in the wards. Like just try to come up with like at least a functional diagnosis while you're still in the wards, where you still have people to correct you, and try to get exposed to as many patients as possible, because they have like a wide range of like diseases they can select from. So sometimes you get easy patients, and sometimes you get cases that you've only ever read about that you don't really see. So it's really, really good to make sure that you like make yourself aware of all like the patients that you have. But then there's also another trick with the end of block exam. Basically, if you get placed at GSH, you're gonna do a clinical exam at a different hospital. So sometimes it helps to talk to the people who are in the hospital to ask them about like the patient profile, where they work, like were there any interesting cases that they might use for the clinical exam, vice versa, like stuff like that. Because if they say that you're going to take an exam at, let's say, at Victoria Hospital, you can just ask the people at Victoria, what type of patients do you guys have right now? Because they're going to use those patients. And then they'll tell you that, okay, we have a lot of heart failures, we have this. And that's exactly what you're going to get, because they're going to be using those patients. So just ask around, and that will make your life easy.
Thanks, Fukuzi. Moving on to the portfolio exam. So basically, this exam, you have to take 10 mixed cases, right? Not not of the same system. Like you can't take 10 cardio cases. It must be mixed. from patients you saw during your calls. Make sure you make follow-up notes of your patients every day you see your patient. The 10 cases should be divided into cardio, respiratory, renal, neuro, and abdo cases. Use common cases, right? To help you a lot if you use common cases, for example, heart failure, congestive cardiac failure. You can also divide it into left or right heart failure if you want to be specific. IHD, ischemic heart disease, infected endocarditis, maybe rheumatic heart fever, COPD, or even asthma as well, TB, pneumonia, HIV, renal failure, acute or chronic, stroke, meningitis, acute gastroenteritis, hepatitis, or liver failure. Let me just admit someone. Okay. Um, So using common cases to help you a lot, to also help you for your clinical exam as well as for your MCQ exam. And make sure you always keep a copy of your clock notes. Always update your 5 block summary as you go along. And don't be afraid to ask your intern or your registrar, your consultant to help, but don't ask them on the last minute. They're going to get angry. Prepare well for this exam because you can score a lot here. It will basically make up for your MCQ exam. Make sure you understand each case to the best of your ability because the examiner will ask you a few questions as well. For example, I had an HIV patient with renal failure and the ARV drug regimen was different because the patient had renal failure. I had to know the ARV drug regimen for a patient with renal failure. So that's just an example of knowing your case quite well. And yeah, anything you would like to add, Kuzi?
Pretty much portfolio exams are pretty much open book exams. So basically you're gonna go to the exam room with a piece of paper which the examiner is not gonna read and only you will be able to read it. So my advice is if you start with Gen Med, when you do your portfolio exam, if you feel that there's stuff you're not gonna remember or stuff they might ask you about that you find difficult to remember, put it on the page. Nobody cares what you put on the page. Like even if you put drugs or whatever. So just like put whatever you feel like they might ask on the page just for your own reading so that you can just refer to it during the exam. And the other thing is, please don't take interesting cases in if you won't be able to defend them. For instance, I had like a type 2 heart attack, and that's like a very, very like a rare diagnosis. So if you take something like that and then put it in the portfolio, they're definitely going to choose it because that's like an interesting case. And usually if a case is that interesting, it's also not really common. So it's probably going to be difficult for you to like defend because they're going to ask you a lot of questions. So just pick cases you can defend. It's an open book exam. Make sure that the cases you pick are stuff you can easily like just on the back of your mind answer, and then you'll be okay.
Thanks, Kuzi. Just okay. MCQ exam. So to prep for this exam, go over all your seminars and complete all the quizzes. This block is quite labor intensive, so try to prioritize and do the quizzes daily. Don't forget your ECG and X-ray skills. Practice daily. The MCQ exam is clinically based, so patient scenarios, ECGs, X-rays, or images will be given, and questions will be asked. Most questions are around you identifying the most likely diagnosis of special investigations or causes and questions and management and also basic sciences. Anything you would like to add, Kuzi?
I don't know, except for that the seminars are not really that helpful for the exam. So the MCQ exam, they just ask anything and everything. So they'll ask you everything about medicine. So yeah, you really have to make sure that you pay attention in the words. Most of the time, they'll ask you something and you just remember it from seeing it in the word that, oh, when I had this type of patient, this was the issue. So like, yeah, make sure that you listen in the word. Make sure that like, you learn a lot because the seminars can only take you so far. The MCQ, they can
True.
ask you anything and everything. And there's going to be dermatology. Those are going to be your easy marks. Make sure that when you look at the dermatology lectures, remember those pictures because those are your easy to get marks. The general medicine marks are a bit, yeah, it's quite broad. So yeah, but then just try. I think there's like something, I don't know if it's genetics, but there's like some people who have like MCQs, like collated MCQs, just use those to practice and sometimes they repeat them. And I also know there's like a certain question bank with ECGs. So just ask around, like Do you
Yeah,
know anyone who has like a question bank with ECGs? Because they use the same ECGs all the time. So just make sure that you get the question bank.
perfect. So basically, these are a list of resources. That's quite helpful. Talent Corner, Migrants Medical Science, Services in Medicine, Medical Flash Notes, like an app that you can use as well. Medschool.co. That's also like some quizzes there you can use on there you can practice on as well in osmosis and Ninja Nurse like for your basic revision of the clinical sciences. Is there any resources that I missed, Kuzi, that you'd like to maybe add?
I mean, like there's like a lot of internal medicine textbooks. There's like a lot. There's also, is it Clark? I don't know if it's like Kuma and Clark. There's also
Yes,
Kuma and
yes,
Clark. But the good
yes.
thing is these are easy to download, man. Just go on the internet and just go
Yeah,
internal medicine textbook. There's gonna be a bunch that's gonna come up. So just download those and find what works for you. But also like at fourth year, they don't really worry much about management. In the world, they will want you to know, but for the
yeah,
exam, you don't really have to know a lot about the pill
true.
and the drugs. So just focus on knowing the disease and how to diagnose it.
Yeah. Like fourth year, it's mainly about getting to a diagnosis. They don't want to know the we don't have to like know the management because that's more final year internal medicine. Now they just want to know, can based on a history and an examination, can you get to a differential diagnosis for this patient, basically? Okay, MBK is very chilled. The MCQ does show you flame because it's very broad, as Fuzi has mentioned. Um, but not as bad as it's not the block is not as bad as Woodkey. So you see patients in a group, and afterwards you make a mind map of the presenting complaint and a table of the of the differential diagnosis, so the important positives and negatives. The evidence-based medicine task and the primary healthcare task, it's not too hectic. For the MCQ exam, for the Manila South or the PAC manual, um, but also go over like the lecture material that they provide as well. It's not entirely helpful, but it will give you like, how can I say, some information to equip you with answering the questions. Practice clinical scenario questions online, perhaps like to build your clinical reasoning. Know the basics, try to watch YouTube videos on like answering clinical questions. So again, the main purpose of GenMed is to provide like you need to provide your approach to getting a diagnosis and your approach to like to management as well. Make a story and remember that that's going to be repeated in sixth year as well. So keep your notes for final year. Anything that you'd like to add, Fukuzi, for the MBK? No, it's a quite chilled block.
Oh yeah, it was. I think for GenMed, I don't know, like if these people are gonna be starting with GenMed, I think it will be helpful to ask around because you're gonna be placed at different hospitals. So I think it would be helpful to ask around, like people were doing fourth year last year, which hospitals they were at and what their experiences were like, because the learning experience kind of varies depending on where you are placed. There's some hospitals that teach a lot, and there's some hospitals that like make that want you to be like very independent. So I think just ask around, and if you find that you want a certain hospital, you can send an email and request it. So I really like employ you to ask around.
Yes. Thanks. Emergency medicine, also a very fun rotation. You work at the emergency center and really the same as Gen Med, where you present your patients to your intern and obviously you present your mini CXs. Don't get to get your logbook signed off. Have an open mind and be willing to learn. You also draw bloods, IV lines, ECGs, maybe suturing if you're lucky, because I heard some students at I think it was at the district hospital that they got to do some suturing and many more things as well. And then for the exam, the lecture material is quite helpful. Anything you'd like to add, Fuzi?
I mean, just get your logbook signed. You don't want to make an extra
Yeah.
sheet because you didn't get it signed. That's pretty much it.
Okay.
And also, doctors are kind of mean sometimes. So just get used to it. And you're going to suck at some skills at first. Like you haven't done it in a real patient. So if you suck at first, it's okay, man. You'll get the hang of it.
Okay, anesthesia. It's very exciting rotation. You also get a lot more procedures you need to either observe or do. You go to surgery and learn how to intubate the patient, how to operate the ventilator, how to put someone to sleep, etc. The MCQ is very nice. Just go over all the research material and do all the quizzes. And most of the MCQ questions actually come from the quizzes as well. Anything you'd like to add, Vukuzi?
Pretty much for anesthesia is that please make sure that you make the doctors make you do stuff. I don't know if that makes sense. Because like there's like some stuff you have to get signed off, and some doctors don't mind having you just sit in the theater and not doing anything. They won't even talk to you. So make sure
Yeah.
that like you take the initiative. Just ask, can I do this? Can I do this? So that you can get stuff signed. Because if you
Yes.
don't, oh man, you'll be stuck on the last week and you still have to get procedures signed and you won't be able to take the exam if you haven't done all your procedures. So just always ask to
Exactly.
do procedures, even if they say no, you'd have tried.
Yes. Thanks, Fukuzi, for that. And don't be shy, guys. Like I know, because I know in the theater, all the surgeons they like look very busy, and the anesthetists look very busy and try to go early mornings. Like go 7 o'clock. If you can go 7 o'clock, go 7 o'clock. And you will get if you go early because they start with the surgeries usually at 8 o'clock. So if you go 7 o'clock, you have enough time to do a lot of things done in your logbook. Obstetric. Okay, we have less than a minute. The meeting is gonna switch off. So I'm thinking I'm gonna stop here. Then we can rejoin on the same link. I don't know if the same link is gonna work or I have to generate another link. But yeah, I'll just stop and then we can rejoin again.